Hello, I'm Dr. Dan Berger and talking to you today, Saturday morning, April 4th, 2020, about COVID-19. But I'd like to be more specific about discussing a subject that has been less talked about with this particular virus, namely, what associations are there of this coronavirus to people living with HIV? What do we know about HIV medications, including Truvada and Descovy, and their possible effect on COVID-19? Is there more risk to individuals who are HIV positive? Do the HIV antivirals afford any benefit to fighting this coronavirus, including those used for PrEP? But before we get more into this, I'd like to introduce myself to those of you that don't know me. I've been an HIV clinical researcher and HIV specialist doctor for more than 30 years, and I began my practice during the early days of the AIDS epidemic when no treatment was available and there were many unanswered questions, not unlike being confronted today with COVID-19. So even though I've been here before and I'm hearing many valid concerns among my patients, I feel hopeful that we'll get through this. I'm at home right now because I've been having a little cough, which can be due to any number of other causes. And it certainly isn't preventing me from working and doing virtual visits with my patients. However, like anyone should, if you have even mild symptoms, we should all exercise caution. I live with my life partner, Scott, and we are practicing social distancing even within our home. He and I are currently sleeping in separate bedrooms and trying to keep our distance. He wants so much to hug me, but I'm not letting him, doing my best so that he does not catch whatever I have, even if it's just a cough. Our queer community is grappling with this pandemic in a way that is different than the larger public. I can speak about this personally as one who lived through and survived the horrors of the AIDS epidemic. For members of our community who were around during the desperate days of the 1980s and 90s, we remember a different plague, when there was government inaction, and this current coronavirus crisis is certainly drudging up some of those memories. But we mobilized as a community, and with a strong concerted effort, we eventually defeated HIV pharmacologically, though many still struggle due to unequal access to healthcare. Our community of AIDS activists back in the day mobilized, fought hard, and helped support our loved ones and family. Importantly, because of the work of AIDS activists, compassionate track programs were first established during the AIDS epidemic to enable individuals stricken with HIV or other life-threatening diseases and allow crucial early access for promising yet unapproved medications. Likewise now, we have a government that responded late, but the pathway to get early access to investigation medications is in place and being utilized now. The Compassionate Access Program for remdesivir allows patients to be treated for COVID-19, though it's still in the testing stages. Also, Dr. Anthony Fauci, who I know from the earlier years of the AIDS epidemic and who was then director of the National Institute of Allergy and Infectious Disease, is at the helm once again. He serves on the White House Coronavirus Task Force and is serving as the credible public health spokesperson and influencing Washington to take a more cautious approach, such as advocating for a longer needed period of social distancing. Okay, so let's talk about COVID-19. It is highly contagious, and the degree of severity of illness is something we've not seen before. But eventually, individuals may have no symptoms if they get exposed or never develop symptoms. And yet, oddly, they are still able to infect others and multiple individuals. Many individuals are believed not to get very sick with only mild respiratory symptoms, such as sore throat, runny nose, feeling fatigued, achiness, cough, but they are still highly infectious to others. Also, others can present with severe symptoms and develop shortness of breath, chest tightness, and even respiratory distress. And we can't readily predict who gets what kind or degree of illness. However, because of its highly contagious nature, everyone needs to take all the necessary precautions put out by the Center for Disease Control, so as not to endanger our partners, family, friends, coworkers, or anyone they come in contact with, be it at a supermarket or elsewhere. Finally, the virus can live on inanimate surfaces, so we need to wash surfaces with soaps or disinfectants. As humans, we are vulnerable and we need to take care of ourselves and each other, regardless of our age and health status. I've had many patients calling me recently because they're experiencing a rise in anxiety, and sometimes the anxiety symptoms can lead to shortness of breath. If one is not having fever, nor cough, fatigue, but only anxiety and shortness of breath, it's likely that the shortness of breath is related to the anxiety and not having COVID-19. Something I've done at home with my partner is set some house rules. We don't discuss COVID statistics at nighttime. We limit television and internet-related COVID programs, especially during evening hours. This helps us sleep better, and I think a break from all this noise is healthy. So firstly, if one develops minor symptoms such as cough or sore throat, don't panic. Take and watch your temperature, get in touch with your health provider, stay at home, drink lots of fluids. I like chicken soup because that's how I was brought up, and my mother swore by it for any flu-like illness. But kidding aside, it has lots of electrolytes, and the heat from the soup acts as a vasodilator, meaning it increases blood flow and oxygen to the throat and other areas. Don't be afraid to make a large pot of soup and drink it all, or put it back in the fridge for later. Also, sleep and rest is the best thing you can do for yourself when one is sick. If you're feeling sick and living with someone else, your partner, husband, wife, lover, significant other, roommate should sleep in a separate bedroom, or one of you take the couch. Keep your distance. The recommendation is 6 feet away, and frequently wash your hands for at least 20 seconds. Avoid touching your face. Wash down all surfaces, including frequently used items such as light switches, cell phones, kitchen counters, etc. If you need any advice, we at North Star are open and available every day, and someone is always on call 24/7. And I'm going to continue to do these online education talks, and we'll plan a follow-up session to be more interactive so that you can ask questions. Please watch North Star's website or Iceberg Chicago's website for scheduling and further news. But next, I'd like to talk and discuss the particular issues for HIV-positive individuals and whether exposure to this coronavirus poses any added risk. We learned that individuals who are HIV-positive and co-infected with hepatitis C, for example, were at a higher risk for progression of liver disease, and it would happen more rapidly because they would also be HIV positive. But on the other hand, we've also demonstrated that people currently living with HIV infection who had antiviral therapy initiated early and take their medications faithfully can have a normal life expectancy compared to others not living with HIV. Also, we are witnessing that HIV positive individuals are living longer and getting older. So just like myself getting older, my patients are getting older with me. And with that, we've become extra vigilant, exercising preventive measures in our patients to reduce aging-related complications. But now, here we are, and we're confronted with this new coronavirus. I talk with many of our patients who are HIV positive, some complaining of increased anxiety and being concerned, feeling they may be extra vulnerable. Discussing this issue by webcast, Dr. John Brooks from the CDC stated that although we don't know with any certainty, he expects that for patients with low CD4 counts and those who be at an increased risk with COVID-19. This makes sense to me, but I'd like to add that blanket statements for all HIV positive individuals shouldn't be made. Many persons with HIV infection are otherwise healthy, and because they see their providers or physicians regularly, they're monitored more closely, and they seem to do very well overall. So individuals living with HIV should always take precautions such as getting their yearly flu shot, eat healthier, regular exercise, and many common sense things that I don't need to go into here. And I don't mind adding that as the director of a large private HIV research and treatment center, and I've taken care of thousands of patients, it's rare that we've had to hospitalize someone with flu or influenza, and many of our HIV positive patients have had all kinds of surgeries, including heart surgery, spinal surgeries, ear, nose, and throat procedures, you name it, and they do just as well as anyone else and without extra infectious complications. So to the question of whether HIV positive individuals are at greater risk to become ill after COVID-19 exposure, I'd say that the bottom line here is we do not know with any certainty. There's no data yet. But I'm encouraged that as a community, we'll get through this. And there's a good chance that HIV positive individuals may benefit from being on antivirals, which I'll soon explain later in this talk. In the meantime, please exercise all the precautions that are being advised by our health departments. I've probably mentioned taking precautions many times already, and I'm probably going to mention them more because you can't overemphasize this. It's so important. So the next topic I'd like to discuss is HIV meds. As antivirals, can they be helpful against COVID-19? Coincidentally, among the top medications touted to be possibly effective against COVID-19, several HIV meds made the top of the list. An HIV antiviral combination pill called Kaletra is one of several in the drug class called protease inhibitors that has been getting lots of press early on. But though early studies showed it having anti-coronavirus activity in the test tube, to date, we haven't seen proof or data showing Kaletra to be effective in actual patients. A problem with some of the early studies is that they were conducted in patients that were already quite ill and hospitalized. Would it have been more effective if this treatment was initiated early? Also, HIV positive individuals take a cocktail of meds that usually include 3 antivirals in one pill, such as in Biktarvy, Simtuza, or Odefsey, and are otherwise quite healthy. I therefore say we can't know with any certainty whether HIV meds could help prevent symptoms or improve individuals' ability to fight off coronavirus more quickly. In other words, we just don't know whether the test tube findings that antivirals for HIV can have anti-coronavirus activity in the lab would actually translate to humans, being HIV positive or not. I'd like to propose that institutions seeing large numbers of patients analyze their data as follows. Conduct a retrospective analysis of a pool of patients, HIV positive, taking their HIV cocktails who also had a positive test to COVID-19, and compare their course to other non-HIV infected individuals. Theoretically, a study like this may help us understand whether HIV medications help persons who are not as sick, and this data could have important implications for the public at large. I'd like to mention one case report that came out of China of a single patient who presented with COVID-19, who was hospitalized and diagnosed with HIV at the same time. He was put on Kaletra, the protease inhibitor I've just spoken about, taking 1 tablet twice daily, and the physicians reported that the patient did well and eventually was discharged from the hospital. But this case report of one patient is basically not useful for us to draw any conclusions from, except to say that here's an example of someone who was HIV positive, was not even on treatment for HIV prior to COVID-19 diagnosis, and still did well. So you can say that this is an example that shows that being HIV positive is not a death sentence by any means in this individual. I'd like to move on to COVID-19 treatments that are actively investigated at this moment. There's been much talk since Trump mentioned an anti-malaria drug during one of his press briefings. I'm referring to hydroxychloroquine being used with azithromycin. Hydroxychloroquine and chloroquine are malaria, but also lupus and different types of arthritis and rheumatic diseases, and has antiviral activity against COVID-19, and is being used with azithromycin for better efficacy. Azithromycin is an antibiotic used for sinus infections, also known to many as the Z-Pak. 2 different reports, one of 100 patients in China and a second of 30 patients in France, all on treatment with chloroquine, experienced a more rapid decline in fever and lung disease, and also recovered within shorter time frames without serious side effects. Further studies are underway here in the United States, and though full results will not be available for several weeks, a data safety monitoring board is examining the effects next week, and information may emerge if the treatment is indeed found to be successful. Although this is only anecdotal, I've been using this cocktail in some of my patients as well, and I'm hopeful. Another promising treatment being investigated to treat COVID-19 is the antiviral drug remdesivir, being developed coincidentally by Gilead Sciences, the same company that is responsible for developing some of the lead treatments for HIV as well as PrEP. At this date, Gilead is sponsoring as many as 10 different trials in several countries, researching the potential role of remdesivir in treating individuals with COVID-19. It is a medication that does not come in pill form, but requires administration intravenously. So it is given in hospitalized patients. We should get results of some of their studies soon, probably even this month. So what else can we do? Many of my patients are asking what else could they be doing to stay healthy besides the cautionary measures, such as hand washing, social distances, wearing a mask whenever going outside or in public places, such as supermarkets, and using gloves when appropriate. I've been telling people that if you're a smoker, this is the perfect time to quit smoking. Clearly, smokers can have greater risks to having breathing issues if they get infected with the virus or COVID-19. Also, since we're not going out, one should maintain some form of exercise at home. One doesn't need a home gym, and one can order exercise bands. If there are weights at home, this is the time to take them out. One of my doctor buddies tells me he turns down the lights, turns up the music, and dances around the room for 15 minutes, especially when he feels he needs to let off some steam. As a supplement, zinc lozenges may be helpful. Zinc has long been purported to augment certain cell-mediated immune functions, which can help fight off viruses. However, before taking it, please consult your physician to make sure that there are no drug interactions with your other medications. Also, eat nutritional food. You can take antioxidants such as vitamin C and E, which would help maintain healthy tissues and cells. So let's talk about care and monitoring of individuals on HIV treatment and PrEP. For individuals on HIV treatment, because we're encouraging people to stay at home and reduce clinic visits, continue to follow up with your physician or provider doing virtual visits, which is what we're doing here at North Star. I'd recommend avoiding drastic switches of HIV meds unless medically necessary. If switching can be safely postponed, we can more easily defer the follow-up labs that are normally done after the medication changes are made. Additionally, we recommend it to do STD screening for patients that are sexually active. However, in our current situation, where we need to practice social distancing, one should avoid the usual meetings or hookups via the apps such as Grindr. But being sex positive and sensitive to queer culture, I think at this time, having phone sex or cyber sex through the internet is a safe alternative. Thus, frequent STD testing may be less necessary, unless one were to develop symptoms, of course. For cyber sex, there are various products produced by a company called Lovence that makes smart sex toys, which can be controlled by Bluetooth and a mobile app. One can operate the product from your phone or home computer, which can perform sex on an individual in, say, a different house or even city. I should caution you that although your computer can catch a virus, it's best you don't. Anyhow, I've heard that one of these cyber sex products called Lush seems to be very popular. Leather 6410 is a store in Chicago that carries this and other products. If anyone needs further information or education, I bet the staff and co-owners of Leather 6410 are very provided. Also, for those of you at home with a husband, partner, significant other, or wife, monogamy can be fun and safe. I'd like to conclude this talk by saying we don't have all the answers. In full transparency, there are many more questions than there are answers at this moment. But I do think there's reason for hope. Medical research and technology is moving rapidly, and I think we'll have established effective treatments soon. I also believe we'll have a vaccine in record time, as multiple companies are racing to provide the world with the much needed safety measure. Also, there's hope that many individuals who are HIV positive may not be at higher risk. Moreover, we may find that HIV medications may help, as explained earlier, but please take all the necessary precautions such as social distancing. And I'd like to thank our community for their efforts. Our educators, the many organizations that provide hope and help to persons with HIV infection, our officials who are working tirelessly to help provide COVID-19 testing and treatment, our many dedicated health professionals who are on the front lines, and especially my medical family at North Star Healthcare in Chicago, with whom I work with side by side and day to day, and my co-conspirators at Iceberg Projects Chicago that are helping me produce this video chat with you today. Thank you for watching, and I wish you all good health and safety.